Hello and welcome to another episode of Spotlight on right here on S24 Television. Today we shine the spotlight on a doctor whose work extends far beyond consulting room. She has treated patients, spoken to communities, educated millions through media, and challenged Nigerians to rethink what it means to stay healthy. But in a country where hospitals are overcrowded, preventable diseases continue to kill, fake cures spread faster than medical facts, and many people trust social media more than their doctors. One question remains: is Nigeria facing a healthcare crisis or simply a crisis of leadership? She is a medical doctor, a public health advocate, a health communicator, and one of the emerging voices shaping conversations around healthcare in Nigeria today. Can information save more lives than medicine? Why do Nigerians still die from diseases that are easily preventable? Has social media become medicine's greatest ally or its biggest enemy? And when healthcare fails, who should Nigerians blame? Today, we have on board Dr. Mariam Ahmed Al-Mustafa. Hello, Dr. Mariam.
Hi. Thank
Good
you
to have you in the studio today.
Thank you for having me.
Yeah. So before going into the conversation, the heated conversation, of course, let's know you first. Before people knew you as a medical doctor, who was Mariam Al-Mustafa?
Well, my name is Dr. Mariam Ahmed Al-Mustafa.
Yeah.
I was born and raised in Bauchi. I attended my medical university and received my medical education in Bahrain. When I came back, I had an interest in internal medicine, and I ventured into that, which I'm doing now, with a special interest in nephrology. But apart from that, I also ventured into public health awareness, social advocacy on health, because of the poor seeking behavior in Nigerians. So I've put a lot of work into the social media space, to clear common misconceptions on health, as well as encourage health seeking behavior.
But do you always know that medicine was your calling, or did life just choose it for you? Here, become a medical doctor.
Funny enough, I've always wanted to be a doctor, but I think there was one time in my life where I struggled to choose either between medicine and law, because my father is a lawyer. So I was thinking, but then as I grew up, I matured more. I just realized that medicine is truly the call for me, because I'm naturally a curious person. I love learning about the human body, how things work, and I love physics, chemistry.
Do you have any regrets so far?
No. Well, no.
Are you sure about that? Because we're about to get into the conversation that will define if you have regrets or
I will
not.
say no, I don't have any regrets.
Okay, so growing up, what shaped your curiosity about health?
Well, I just was naturally a curious person. Even when I was growing up, my parents used to tell me that I used to ask a lot of questions. So when I started growing up, I went to school. I found that I was enjoying biology, chemistry, physics, just anything to do with like physiology of the human body and how it worked. I just found it fascinating to understand your own body. So that was what piqued my interest at the beginning.
We know medical doctors to talk about their schooling to be very, very difficult. Okay. Medical school, it tends to look like it's break people. So what part of this process almost, pulled you out?
Okay, so medical school is not easy, but at the same time, the level of difficulty depends on where you go to school, let's say, like where you go to school. So I was privileged enough to study abroad. So the kind of environment that I was in, there was a lot of focus on studying and less toxicity. So when people talk about difficulty in medical school, they usually talk about several factors. The first, obviously, being the academic workload. The second being the attitude of your teachers and your professors sometimes. They don't make it a friendly environment where you can, open up, talk, ask questions, feel free. That puts a lot of pressure into people. And then number three is the sacrifices that people make. For example, they miss weddings, outings. You almost give up your young adulthood for the sake of medicine. So I think when it comes to that, I would say medical school is difficult, but it really depends on where you are.
When you're talking about it depends on where you are, is that contracts like private to government school, or maybe schools in Nigeria and schools abroad?
I wouldn't say it has to be either maybe private or public or abroad or not abroad. I just feel like it depends on the people that are teaching you. You can be fortunate enough, like me, to be surrounded by people that inspire you, that encourage you, that don't put a lot of pressure for you, that are always there for you and are always willing to help you grow, rather than in an environment where you are forced to maybe just do things that even they themselves cannot do. Do you understand?
Yeah.
A lot of expectations, almost people thinking or expecting you to be almost subhuman or something.
Perfect.
Yeah, exactly. Not even perfect. Just they push you beyond your limit in many ways, academically, emotionally. Do you understand? Psychologically. So I think if when people grow or go to schools where they have a lot of support,
Yeah.
and no matter how difficult it is, at least if you can open up to your teacher, if you can talk, the environment is friendly, I think that relieves a lot of stress.
Yeah.
Yes.
So what experience transformed you from a medical doctor to a physician?
Well, in Nigeria specifically.
Whichever one.
Okay. So, I have to think about this one. Can you repeat the question? Sorry.
So how did you, when did you realize you want to become a physician? Okay. Yeah.
So I used to always say that internal medicine chose me.
Okay.
Yes, when I was in school, I was always very good academically in the internal medicine line. There was a time when I came back to Nigeria, I struggled between O&G, which is obstetrics and gynecology, and then internal medicine. But then I found that I couldn't really keep up with the workload in O&G. It's very demanding. It's a very demanding specialty. Okay. Yes, I was on call almost every 3 days. Like you only rest for 2 days. And then I found that surgical specialties aren't really for me. I used to faint a lot during surgery. Wow. Yeah, the postural hypertension. So it's just the vagal atmosphere. You see blood everywhere. You get increased vagal tone, and then you're standing for a long period. And I have borderline almost low blood pressure. So surgery just definitely wasn't for me. I couldn't go into pediatrics, definitely not. So medicine just kind of aligned with me and my personality, and that's why I went with it.
Well, that's interesting. So let's move away from trying to know who you are to the actual conversation of today. If Nigerian healthcare system is actually failing, Nigerians are losing doctors every day to migration. Should Nigerians be worried about this?
Absolutely. And the sad part is Nigerians are not only losing doctors to immigration, they're also losing doctors because doctors are dying. So when it comes to losing doctors, obviously the biggest factor is the Japa syndrome, the immigration, and that has various reasons to it, which we can go in. I think the statistics before, I think the recommended, I need to check that actually. So I'll just skip that. Can you just ask me the question again?
I want to know if Nigerians should be worried with the fact that Nigerian doctors are leaving the country.
Yes, they should absolutely be worried because there is a recommended statistics for what one doctor should be to how many patients. So one doctor to how many patients, okay?
So what's the number?
That's what I'm saying. I didn't know you would ask me that question. So do you need to ask me again so that
you can just move on.
No problem. Okay. So there is a recommended doctor to patient ratio. And the last time I checked, we have fallen way beyond that. Okay. So doctors are overworked, the ones that are even here. And the issue is when doctors leave for various reasons, it can be, financial issues, system failure, all that. The ones that are left, okay, the workload remains the same. In fact, I would say the workload increases because our population is increasing. So doctors are leaving. Doctors are not being replaced. The ones that are left are now having to carry the load or fill the gaps of the doctors that are left. They now end up being discouraged and also looking to see greener pastures. So it's like a vicious cycle. So when doctors are leaving, incentives should be made to encourage the ones that have stayed or have chosen to stay, or the ones that are even thinking of leaving but are conflicted. But none of that is being done. And in fact, they're almost being punished for it. Do you understand? So I feel like Nigerians should absolutely be worried because in the next few years, if nothing is done, the Japa syndrome is going to be worse than we think it is now.
With the Japa syndrome, one would think that Nigerians should be proud that their medical doctors are required outside the country. But the question now is, do you think this Japa syndrome is actually destroying the health system in Nigeria? Okay,
so that can be yes and a no. So some people argue that people that are jabbering are the smart doctors, they are leaving only the dumb ones. But I wouldn't say that's correct because they're very talented doctors that are around and they're just choosing to stay because of, their obligation to their country, obligation to their family and just conscience because they used to say like, if all the doctors leave, who will take care of our relatives? So we have a lot of talented, bright doctors that are around. But again, system failure doesn't allow them to flourish. So I think this issue of Japa is something that I think I just don't feel like it's being taken seriously enough.
Or do you think this issue of Japa is actually exposing an existing problem that has been there for a long time?
Yes, the problem of healthcare in Nigeria is not a secret. It has been there since before I went to medical school. And the same problems that are still there before I went to medical school are the same problems that we are dealing with now, and worse. Do you understand? So it's just exposing. I would say yes, it's exposing, because people didn't used to pay attention to it until the doctors started leaving. And we have a lot of deficiency right now. Can you believe in the entirety of Abuja, in my field, at least in internal medicine, we're suffering from lack of certain specialties like rheumatology. So we'll have patients that actually need care like that, but there aren't much. So it's heartbreaking to see. Not only is it heartbreaking on the patient's side, it's also heartbreaking on our side. Do you understand?
So you're talking about having some certain illness in the hospital that there are no health workers, to cater for them.
Yes.
And this is making, because patients are now of this realization, they are thinking that hospital is not a place to fear, and not where you go to with so much confidence that you're going to be treated.
I would beg to differ. So I would beg to differ for the pure fact that a hospital is still a hospital, and for a reason. A hospital is a hospital because they have professionals there that know what they're doing. I'll give you an example. I've had, I wanted to do a video about this and talk to patients, because going to the hospital now is almost inconvenient in a way, because when you go, there's a long queue, there's crowd. Before you do this, they'll say, do this, buy this, do. So it's like, it's almost stresses patients, but at the end of the day, you're still in the right hands. Some people try to bypass that. And, they go to the chemist, pharmacy, or whatever. And for my field in nephrology specifically, we've had multiple incidences where patients are coming in with acute kidney injury because they simply fell into the wrong hands and received medications that they could have received a better alternative.
That is the fear from patients, that maybe, cases become even more difficult than what they've taken to the hospital.
That might be correct. That might be true, but they are still safer in the hands of doctors and hospitals. So if mistakes will happen, okay? Regardless of if you have the best medical team in the world, mistakes happen. However, in medicine, there are so many systems in place. There's something called the Swiss cheese model. So you have so many systems in place to prevent medical errors, okay? But sometimes a medical error might happen. So my point is, even if something will happen, you have a significantly less chance of it happening in the hospital under the hands of qualified doctors than in the hands of so-called people that will heal you or cure your diabetes, or so patients need to know that it's a risk, but the benefit outweighs the risk.
Do you think patients are also encouraging this? Because medical doctors feel like patients, apart from the system that has failed them, even patients are not encouraging the situation.
Well, sometimes we do feel like we can use more support from our patients, because for example, when we come out to say, look, we have a problem in here, this, so, and so, we need this and this and this, and we start almost arguing with the government or something. It's almost like just mute on the public side. So at least if people can show support, when doctors are trying to fight for these things, if they can come up and also back the doctors, I think that will put more pressure on the people that are supposed to do something about it.
So if you become the health minister today, what are those things you're going to work on first? Wait, do not answer that. So we'll be going for a break. And when we come back, the conversation continues. Let's go for a quick break. And when we return, we'll be hearing from the horse's mouth what they think the actual solutions should be. Welcome back. If you're just joining us, this has been Spotlight On, and I'm here with a medical doctor to talk to us about the troubles and what the possible solutions could be. I've asked the question before: if you become the health minister today, what are those first three things you would, put your hand into first?
Okay, first three things, right?
Yeah.
The first thing I would do is try to advocate for more budget to be allocated to the healthcare system. We need basic equipments in our hospitals, even the infrastructure of the hospitals need work. Like I've seen heartbreaking videos of tertiary hospitals or specialist hospitals where it's raining and roofs are leaking and patients are pushed to the side.
Wow.
Somebody that's sick, do they spend their energy on healing, or do they spend the energy on trying to move away from water, stay dry? That's very sad. So health infrastructure, health equipment, because in the entirety of Abuja, I don't even know how many government hospitals have MRI. In my hospital, we don't have an MRI, we have a CT scan. So, the basic lab tests that you can't do in said government hospitals, you have to send patients to private labs, and it's expensive. So I feel like, number one, I would like to advocate for more budget to be allocated to the healthcare system, healthcare sector, so that we can.
That's for the infrastructure.
Medical equipment. Yes.
Are you sure the rest of your medical doctors are in support of this? Because when I said first three things, the first thing you mentioned is infrastructure.
I'm coming to that. I know you want to say welfare.
All right,
that's my second point. So there is this big misconception about doctors that all we care about is money. Pay us. We want more money. And people say, but you're doing a lot better than so many Nigerians.
But in our defense, you're always asking for money.
We are. And there is a reason why, which I will explain. But let me take care of this. So this misconception, to be honest, if you put a doctor down and ask him, should I increase your salary to so, or should I make the system work?
Yeah.
He will go for the system to work first before he talks about salary. Because no matter how much you pay us, if the system is not working, I'm almost wasting my degree. Do you understand?
Yeah.
I don't feel like I'm saving lives. It's so sad for somebody to die because there's something
you would have
broken.
Done easily.
Do you understand? Something, if the system worked, I can assure you that doctors will be complaining a whole lot less. Because at the end of the day, even if they're underpaid, at least they saved life. They would go home with that gratification, though, I saved a life today. But imagine if you're poorly paid and then you try your best, you put in hours of work and patients die anyway. What? Because of system failure. So that will make you angry and you'll be like, okay, at least what am I getting from this?
Yeah.
If the system won't work, at least pay me what I'm due. And that brings me to the second point where doctors are always asking for money. Let me just paint a picture for you, okay?
All right.
You will go to medical school. Medical school is not cheap, depending on where you go. Okay, I know it's cheaper in Nigeria. After medical school, if you graduated outside, you have to write the MDCN exam. And I don't know if you've seen the news, but they recently just increased the fees. Skyrocketed. Yeah, that's number two. Number three, after that, there's something called primaries. Okay, you write your primaries exam, you pay for it. All of this, you're not being paid. It's maybe after a house job, maybe you gather money. Then maybe you pay for primaries, After that, you do your NYC. Then after the NYC, you do your residency. During residency, you're expected to attend update courses, which cost money. Okay, and this is even local update courses. Then you write exams. There's part 1 exam, and it depends on the college. Is it national or West Africa? National is cheaper. I think West Africa, you have to pay over $500. After you pass part 1, depending on the college, you now pay an induction fee of over 1 million naira. After that, you now do your thesis. That's even if you are sticking with one college. Because if you're doing both colleges, you have to pay building levy, all those membership fees, all that for both colleges. After that, you have to write your book, which is your research. Okay? Yeah. And nobody will give you money for it. And you have to do it to write your part 2. After your book, you spend your money on it, which are millions of naira, by the way. Just depending, the budget can be as low as 2 million to as high as whatever, depending on what your research is. Then part 2 comes. You also pay money to write part 2. After you pass part 2, you now pay money again to be inducted. All this that I'm telling you is exclusive of if you want to compete on the global scale. Yeah. And that is why I always say that people are really being unfair to Nigerian doctors. If you check other doctors, they attend international conferences. If they do researches, they go, they present, they interact, they build network, they attend courses. Do you understand? Yeah. Like study materials, books. We can't even afford books. Do you understand? It's like if you're blessed, or maybe your parents are, alhamdulillah, or your husband is, for us women at least, I can't even imagine what the men are going through. So you can't even pay for question banks. Do you understand? So you're left with like scraps of what people are willing to share. And then,
not to talk of your basic needs.
And then journals. You don't have, unless if you have somebody that is subscribed to journals that will be sending you updates. So how are Nigerian doctors supposed to compete on the global scale when the common thing that they need, update courses, international conferences, online reading materials, journals, they can't pay for it.
So the funding coming from the government does not even match with the reality.
You're paid a salary, okay? You're paid a salary, and then maybe one small allowance like that to buy a white coat. Medical equipments for you, because sometimes you have white coats, you have scrubs, stethoscopes are not cheap, and then when you buy somebody's stills, you have to buy again because there's no excuse. And then sometimes you're doing rounds, there's no pulse oximeter, there's no this. So a lot of doctors just buy their own. And do you understand?
So
and use it.
So you think we are not spending enough on healthcare, or are we spending but spending very poorly?
Let me just send that question back to you. Compare the budget towards healthcare in Nigeria, and then compare the budgets that other countries channel towards their healthcare.
Yeah.
It's a joke.
It doesn't match.
It's very expensive, and I reiterate, it is very expensive to be a doctor. And this is everything that I mentioned. This is from my perspective as a female who is being taken care of almost. Imagine a man who has to, doctors cannot afford to, I know a doctor, like I've heard of a doctor that sold his car to be riding bike to work because he can't afford to be fueling the car, maintaining the car. He has to pay rent. Doctors can no longer afford to buy houses. That's the thing. They can't afford to buy houses. Rents, they can't, in Abuja, they can't stay within Abuja.
I hope my colleague that is always comparing people to teachers can hear, can listen and understand what you guys are going through.
The teachers are going through a lot as well. I don't want to undermine anybody's struggle. You know, I think the three biggest issues, the sectors that really need to work in Nigeria, you know, the education, security and health. So the teachers, the law enforcers, and then the doctors.
In order not for us to be biased, let's move from the medical doctors to the patients.
Okay.
Do you think healthcare has become a privilege for them instead of a right? Because when you check our rights, we have right to, So do you think it has now become a privilege in Nigeria and no longer a right?
Exactly. For the pure fact that most patients cannot afford healthcare. So for a patient to walk into the hospital sick and walk out of the hospital fine and good is now a privilege, because a lot, especially for a very, very sick patient. I'll just use my own specialty to give you an example. Let's say you have somebody that comes in with an AKI, okay? Or let's even use a chronic kidney disease patient who unfortunately has advanced to the end stage of kidney disease, and so maybe the last stage, and probably needs renal replacement therapy, which can be either in the form of dialysis or transplant. So let's take the dialysis route, because that's most of our patients are on maintenance dialysis. For you to have dialysis, at least the average cost around per session is like 45,000. So you may need it 3 times a week for the rest of your life. How many patients can afford that? So just think, God has, you're living right now with your 2 kidneys. You don't even know, some people don't even know they have 2 kidneys because they have not failed. Do you understand? That's how privileged we are as healthy humans. We don't know what the kidneys are doing for us. But then somebody whose kidneys have failed, that is when he knows what God has done for him, because now those 2 kidneys that he was living on for free, some people even are abusing, taking things that could harm the kidneys. Let's not go into that. Now he just realizes that, oh my God, now I actually need to take over, okay? The kidneys cannot do the work for me, so I need this machine, the help of this machine. But this machine now costs 45,000 naira. And I need it every alternate day, 3 times a week, every week, every month, every year, for the rest of my life. Or if I have a lot of money, I can do transplant. That's people that are financially okay. So how many patients can afford that in Nigeria? So I believe that there are some basic health necessities that should be a right. As a Nigerian, you should have a right to this, even if you can't afford it. But unfortunately, we don't have health schemes like that.
So since you're now our health minister, do you think politicians should be banned from leaving the country,
100%.
outside the country 100%. To get treatment?
Because the only way for the system to work is if they make it work. And the only way they will ensure that they make it work is if they are in the system and they see what is actually happening. So I really do believe that. I just feel like you should be patriotic as a as an official, as a politician, we're voting for you. You love Nigeria. That's what you've told us, and we voted for you because of that. So show us that you love
course, that
Nigeria.
is what they
Attend our
told us.
hospitals. Let our doctors see you. Do you understand? Don't be flying back and forth for a simple throat infection or something. That sends I just feel like that sends a bad message. And even for good publicity, I feel like if these politicians would start attending Nigerian hospitals, see Nigerian doctors, they would give more confidence for patients to come and see. So I think it sends the wrong message when small thing you're flying out, that sends the wrong message because it's like you don't have confidence.
Don't you think that is because they lack confidence in the system they are living behind?
But they created the system. The system is like that because of them.
Yes. Let's talk about misinformation in the healthcare. You do a thing on social media where you try to, simplify some health issues and all of that. I saw a video of you on TikTok where you were saying that women should not carry heavy load and all of that. Some men will come and say that it's just laziness. You know how culture and all of that can, give us. But why is misinformation in healthcare still winning? Because
everybody can take a mic, or everybody can. Okay, let me just say this. People love a quick fix. I'll just use classic hypertension and diabetes as an example.
Yeah.
If you come to the doctor will tell you have to take drug for the rest of your life, or we cannot cure this one. You now go on in the market. Somebody in his car will speak up, telling you, I sell drugs to cure. And these doctors, they don't know what they're doing. Sharp cure. Okay. And because we're humans, okay, obviously we will lean more towards the side of misinformation if it sounds more appealing or more encouraging, or the outlook looks better than what the doctor is telling you. So I feel like it's very easy to have misinformation. Anybody can just come and there's a lot of let's say people are not very educated, especially in the north, like north when you go there. So not everybody knows common health issues. I was just saying the other day, like for example, if somebody has seizure convulsions, some people will put the foot in fire, some people put in their spoon in their mouth. So dangerous things. I was saying the other day from one of somebody I met that he used to hear as a child that if somebody was having Apollo, you put urine in the Do you understand? So and I don't know why Nigerians were so, we like this how do I call it, we like the idea of fantasy. Put onion in something, you get cured. It just sounds believable to us rather than just believing the science.
Who do you think is doing more damage today? Is it the influencer? Because we now have unqualified influencers on social media. Everybody is trying to give you medical advice. Or the fake doctors, or the politicians that come to do fake healthcare promises.
I will always blame the politician, because you have a responsibility to your people, to yourself, and to the system that put you where you are. So I feel like, not that the rest are not to blame, but the leader has to take the first step, and then the rest follow. That's why you're a leader. When you do something, people tend to follow. So I think when our leaders start to actually, oh wow, we need to take this thing seriously, and we actually see them taking things seriously, there will be more eye on fake doctors. I don't even know how many fake hospitals there are. How many people working around. Do you understand? So when the system works, okay, our health system is taken seriously, nobody will even have the courage to come and be parading as a fake doctor.
There's this thing about, when you talk about influencers, you must add celebrities. There's this thing about celebrities coming to, give medical information. Do you think this should be legally regulated?
Yes. As long as you don't have a doctor in your name, I don't think you should come and give a medical advice. You can say what worked for you. For example, hey, this is my experience. I was diagnosed with so and so. This was what the doctors did for me. These were the investigations I had. These were the treatments I had. This were the surgery I had. And frankly, this was what worked for me. Because you're narrating your story. Everybody has a voice and they deserve to tell their story. But you cannot come and tell people what to do. Or
especially this pandemic of trying to lose weight, trying to slim fit, trying to look curvy and all of the BBL pandemic.
Sorry, which question do you want to ask about that?
We are talking about how the celebrities, people are kind of connected to celebrities. So when they come out to give medical information, do you think it should be legally regulated? Like they should be held responsible if they're giving information that are not, ascribed to them?
Yes. Like I said, as a information should be there should be responsible passing of information. So if it is your story to tell, you're narrating your story, fine. So you had this thing done, or you had this particular ailment. This was this so and so was what the doctors did for you. But for you to come and say this is what people should do, and this will do this, you with your own medical claims that have no backing, and you don't have any doctor in front of your name, I just feel like that can be a little dangerous sometimes, because even if you have good intentions, somebody will always misinterpret what you say. And this is something I deal with on a regular basis when I make videos. No matter how clear you are, no matter how more detailed you are, you always find somebody that misinterprets something. So you as a celebrity, if you're coming in with medical information that is unverified, or you don't really have the backing of a doctor, you didn't consult a doctor, and you have the best intentions, somebody can go and misinterpret that, which I guarantee you will happen. And then if something goes south, you're now in trouble. Do you understand?
I would like to ask you what one myth you've encountered during your period of professionality. But let's go on a quick break, and when we return, we'll be coming back to talk about women, mothers, and the healthcare crisis. There is no how you're going to talk about Nigerian healthcare crisis that you will not be, sidelining the female gender to dig deep into their own situation separately. Let's go on a quick break now. When we return, the conversation continue. Welcome back. If you're just joining us, this has been Spotlight On, and I have been talking to a doctor. Being a female doctor, of course, we'll be talking about the women, mothers, when it comes to their healthcare situation separately. But before then, tell us, during your time of, being a doctor, what is the most dangerous myth you've encountered?
The most dangerous
myth you've encountered?
What do you mean myth?
Coming to say, just like the one you mentioned, that when you're conversing, you'll be using the spoon or something.
Okay, I think
those are myths, maybe something traditional that came from,
Okay, I will say the same thing. Okay, you can ask me again, but I'm going to say the same thing.
Yeah, you can just go on.
Okay, so the most dangerous misconceptions, like it involves, for example, like the somebody convulsing, you put a spoon in their mouth, or you put, palm oil, which they can aspirate and make things worse. So I think that's maybe one of the most dangerous things. And then
what about this aspect of, I hope my mother can hear this, when your body scratch, you use palm oil to rub your body. Does that work?
Even if it does, I'm not aware of that. I've never tried that. I wouldn't know. But there's no.
But medically, do we have something like that?
Well, you have lotions that have anti-inflammatory, anti-histamine, or anti-allergic properties, that calm down inflammation, that can work. But they are medically regulated. So these traditional I'm not a traditional herbalist, so I wouldn't know.
So let's move into women, mother, and the healthcare crisis. Nigeria continues to record one of the world's highest maternity mortality rate. Why is this still happening in this time and day?
Okay, so again, goes back to system failure and the lack of education and poor health-seeking behavior. There are a lot of mothers that don't do antenatal care. So as a woman, a pregnancy is probably arguably the most dangerous time of your life. So it needs to be regulated, but unfortunately, not many women feel that way. Maybe because, she's had so many children before, so she feels comfortable with the pregnancy and she doesn't feel the need to check. But there's so many things that can go wrong during the first trimester, second trimester, third trimester. So there are a lot of women that come undocumented. That's why even I think when you go to hospitals, they charge more if you're having a baby and you did not do antenatal care there. We have zero antenatal record. They charge more because the risks are higher. Okay. And then, again, the system failure of maybe a woman goes 20 hours during labor. Maybe you have one nurse in the entire ward or one midwife in the entire ward. So she wouldn't get the attention that she needs. These warning signs will not be picked up early. Or a woman is bleeding, for example, after having a baby, and then maybe not enough attention was paid to how much blood she has lost. Something like all because of either maybe lack of manpower, system failure, or maybe she has bled. Blood is supposed to be given, but then so many delays happen along the way that. So I feel like there's so many, it's I would blame system failure, honestly, and then lack of poor health seeking behavior from women. Because believe it or not, a lot of women don't actually believe in antenatal care, and that is very scary.
But what frustrates you more when you are taking care of a pregnant woman, especially those ones that refuse to do the right thing?
And that's the antenatal care, lack of seeking antenatal care. I'm always very shocked when I'm talking to a pregnant woman and she's expressing that she doesn't do antenatal care.
But don't you think this could be due to lack of funding?
It could be. But I believe antenatal ANC should be free.
Of course, that's my question. Should it be free or not?
It should, absolutely. I feel like even having children should be free. Delivery should be free. A woman shouldn't have to pay, or at least it should be heavily subsidized.
When you're talking about this antenatal care now, we have fault from the mothers, we have fault from the government, the system itself. How do you balance this? Who owns the much more responsibility, the family or the federal government?
For this one, I would say the family, because this is something very, very sensitive. There are a lot of people out there that cannot afford to have children. But at the same time, they for some reason, I don't know why, contraception is villainized. And contraception, surprisingly, is free. Okay? So there are so many underprivileged families that know they cannot afford children. And I'll give an example for that. And they don't feel the need, or they feel like if they do contraception, it's something bad, or like that will tarnish her image as a woman. I don't know, because I genuinely do not understand. There was one woman that I'll never forget that came during my house job. I was in Kano. She came, she had been having labor for how many hours? We don't even know. She was in visibly painful distress and she needed a C-section. The husband did not have money for a C-section. So I don't know even how the case ended up. So for me, it's like, how can you as a family, maybe a husband and a wife, you don't plan these things, or you can't afford it, or you're like, oh, let's just see how it ends. So on this part, I'll actually put the blame not on the government, but on these families.
Because children are blessings from God.
Exactly.
Probably that is why they just think, let's just do this thing. God will take care of.
True. But then who will take care of you as the mother? Do you understand? So I always feel, whenever I remember that woman, it really pains me, because it's like, you couldn't afford this. Your husband, they could not afford this. Even simple delivery, he could not afford. And now a complication has occurred. I don't know what happened to her. I don't know if she's alive or she's dead, but anything can happen as a woman. So don't you think the most responsible thing to do is, even if you're underprivileged, nobody is saying don't have children, okay? But take care of yourself. Even if you're underprivileged, don't you think you should at least be able to have a right to healthcare as a woman when you're pregnant? Do you understand?
Yeah.
So I don't know
Let's move quickly to, public health in relation to politics. Let's see how politics is, changing the dynamics of public health and how it's affecting it. We've had COVID-19 in the past, and we knew how COVID-19 has changed the world. So do you think Nigerians should learn from that, or we are about to make another mistake?
Hopefully not. I think if there's anything Nigerians should learn from that, maybe 1, 2, 3. The first is obviously common hygiene etiquettes. For example, coughing. You enter a taxi, there are 10 people, somebody's coughing, everybody's infected. So at least now people know about cough etiquette. Cover your mouth, wash your hands.
Are you sure people do not go back to their
I'm sure they went back
habits?
to it, but there are some, it can't be everybody. I'm sure at least even if it is 1% of people, I'm sure they have learned something positive from that.
But do you think the vaccination should still be voluntary?
Well, yeah, I do believe that vaccine should be voluntary. Nobody should be forced to take a drug or take a vaccine that they don't want to take, but it's at the detriment of their own health. But it should be made available and people should be educated. But at the end of the day, if they don't want to take it, I don't see a need to force anybody. So
do you think politics have become a threat to public health?
Sorry, what?
Do you think politics have become a threat to public health?
Well, so in a way, it has always been a threat, because everybody will come overpromise and underdeliver at the end of the day.
So when disease outbreaks occur, are governments more concerned about statistics or saving the lives of people?
That I cannot answer. It's for the government to answer for themselves.
But since I'm giving you the Minister of Health for now, you should be able to, chip in and give us some answers.
The focus should always be the people. Do you understand? But that may not always be the case. There are so many things that happen behind the scenes that we may not be privy to. You understand? But I just feel like, obviously.
Let me ask a personal question. Do you think Nigeria is about to experience another pandemic with the way we are going?
I'm praying not. I was positively surprised about this Ebola thing.
Yeah.
To be honest, I had very negative. I didn't have. I was not positive about Ebola not extending to Nigeria, all that. But I'm happy with how the government has actually gone about it. They've been serious. They've kept the public informed. They've put screens in the airport. They fill questionnaires, even though I don't think they were checking temperatures, but maybe that was just the one time I was in the airport. So I think, they've done well on that part.
Let's go into this segment where we ask hard questions, some uncomfortable question. Do you think sometimes doctors feel patient because of poor communication?
Yes, that is a reality that I cannot deny. So a lot of Nigerian patients, this is not even a new or a secret, that a lot of Nigerian doctors are very poor communicators. Even when I was growing up, I didn't think there was something called counseling, that a doctor would sit you down, tell you, oh, this is what you have, this are the treatment options, but at the end of the day, it's what you decide. We are not in charge of you, just ethics. But a lot of Nigerian doctors lack that. I think that's why patients sometimes are very bitter towards doctors. So I think if you're a doctor watching this, try to really, work on your ethics if you're one of those people that don't care to keep patients informed. I think it's very dangerous for patients, because you find that sometimes patients actually comply more when they know about what they're being treated for, about their illness, than when they're just being left in the dark.
So do you think medicine has become more commercial than saving lives?
I would say in a way, yes. Because, for example, if there's this focus on service delivery. So now as doctors, it's like we're expected patients should always be the center of medicine. Medicine is patient-centered. But your obligation is to do things to benefit the patient, to prevent harm, okay? Not to keep patients happy. Now the shift is treat this patient, prevent harm, don't do any malice, and keep the patient happy. Sometimes that is not possible. Do you understand? So, and then I feel like it sets a dangerous tone, and patients develop this privilege when service delivery is focused on more than actually doing your job as a doctor. Because a classic example, you finish seeing a patient, you do everything you need to do. They're leaving, and they say you should give them your number.
Wow.
And when you refuse, they get angry. They say, what if I need a doctor? If you need a doctor, come back to the hospital, So patients have this sometimes privileged way of speaking to doctors, like, it's like doctors owe them healthcare, even when they're off the clock. When a doctor is off the clock, he is off the clock. Trust me, the last thing I want to be doing when I go back home is doing anything doctor-related.
But do you think patients have the right to publicly rate their medical doctors?
Yes, and I think it goes both ways, that doctors can also rate their patients.
But I did not ask if doctors can rate their patients. I'm asking if patients can rate their doctors.
Well, they can.
Medicine
is transparent.
Okay, you're also saying doctors should be able to rate their patients.
Yes, because some patients can be
What are you rating the patient for?
Cooperation, compliance, even attitude. Because sometimes patients come with an attitude and they just dismantle you as a doctor. So I think it goes both ways. I think if everybody is being called out, or people take responsibility, accountability, and then everybody will, do the right thing.
Thank you so much, Doctor. It's been an interesting conversation with her, talking about women, talking about patients, talking about the system generally. Now we move to the last segment before we round up, and this is called Rapid Fire. This is where we ease all the tension of the hard conversations. You are allowed to just pick one word. You get?
Okay.
No medical terminology to defend yourself. So, hospital or community health?
Hospital.
Treatment or prevention?
Prevention, 100%.
Okay. Public hospital or private hospital?
Public.
Public hospitals?
I say that for a reason.
Okay, don't worry about the reason. Experience or technology?
Experience.
Vaccines or awareness?
Awareness.
AI or human judgment?
Human judgment.
One word that describes Nigeria's healthcare system?
In shambles. Is that 2 words?
Okay. One word that describes today's patients?
Maybe cautious.
One word that describe your mission.
Prevention.
Thank you so much, Dr. Mariam Ahmed Al-Mustafa. Today's conversation reminds us that healthcare is more than hospital, is more than prescription, and more than doctors. It is about trust, it is about leadership, it is about ensuring that where a person lives or where they earn does not matter and does not determine where they live. Because in the end, the health of a nation is the foundation of its future. My name is Zainab Ibrahim. This has been Spotlight On. Thank you for watching.